for Bedican, as you see, first is the inspection of the oral cavity. Then there's teeth, gums, mucous membrane, tongue, throat, and tonsils. Okay. This we don't need to do because it's just, you just ask patient to open the mouth and just see how many teeth, number of the caries teeth. So all this is not so important, but you should know this. Okay, but in exam so far during my batch, they did not ask this. Okay, but you just need to hafal, you just hafal all the everything. Okay, oral cavity, teeth, gums, mucous membrane, tongue, throat, and tonsils. The important thing here, you just have to see the size, mucous membrane, because everywhere there is mucous membrane. So mucous membrane is usually what color in normal? Pinkish.
Yes.
So you just say pinkish color mucous membrane. Okay. Other than that, it's all the same. Like in tonsils, you just have to see the tonsils. You just have to say, is it enlarged or not? And that's it. Without pass, you know. So all you just have to just baca only, okay? Itu tak penting sangat. Okay. So now head to the one which will be asked during your practical skills. First, abdomen. Okay? Abdomen. Abdomen, if she says abdomen, okay, don't straight away ask the patient to lie on the bed, because why? Abdomen, you need to inspect the patient in standing position first. Okay, inspect the patient in standing position first. Okay, so what you need to do is just look at the patient.
Equal appearance.
Can.
Okay, so you just look at the patient, inspect from up till here. Okay, inspect. Once you have inspected, then ask the patient to lie on the bed.
Can I have a t-shirt?
Yeah.
Can I? Sit first. Oh, you want to do this? Lie down like this.
Yeah, you have to do like this.
什么有？
Okay, then always remember when your patient is lying, right, your chair, okay, the chair, it must be here. Okay, follow the knee and then you place your chair there, then you sit. Okay,
Why did someone give you a chair?
no lah, I think I just run the bed.
Oh,
Okay, so then, okay, now abdomen. Once you have inspected the abdomen in upright position, now in lying position. Next what you do is size, configuration. Configuration of the abdomen is normal. Okay, here there's absence of scaphoid abdomen. Scaphoid abdomen, it goes macam ni. That's only during pregnancy, or if the patient has ascites, it would be scaphoid. But in this patient, it's normal configuration of the abdomen.
how about obesity? You that?
Obesity, no. Obesity, everything is enlarged, but it doesn't go. Okay, because if it goes like scaphoid, here, there'll be some extra space here. You can actually put your hand inside, because it goes like this, right? So the whole back is not actually on the bed. Yeah. Okay. So then after this, look for diverticulum of the recti. Okay. This is the muscle, musculus rectus abdominis muscle, which is here. Okay. So in this part, you just have to just look. In this case, it's straight. It's straight. But in some patients, you can see the abdominal muscles, it goes like this and it comes like this. But in this patient, everything is normal. Okay. So normal diverticulum. Then there is no retracted belly. No retracted belly. Okay. Then that's it for abdomen. Okay, we have done with abdomen. Next, we go to adiposis. In adiposis, you just have to check for what symmetrical and asymmetrical diverticulum. So in this case, normal. It's normal. Participation in breathing. For guys, it should be abdominal breathing. So in this case, abdominal breathing. See, it's abdominal breathing. Okay. Next, venous network. There's no venous network seen here. Usually, when can you see?
Medusa.
Caput medusa. Caput medusa, because of what?
The something block between.
Portal hypertension.
Hypertension.
In portal hypertension, caput medusa is visible. But in this case, absence of caput medusa, there's absence of spider nevi. Spider nevi is seen in which disease? Liver diseases. Any liver diseases, example liver cirrhosis, this autoimmune liver diseases. Okay, in all these cases, alcoholic liver disease, all this you can see spider nevi. Anything to do with the liver, spider nevi can be seen. Okay, so in this case, absence of that. Next, visible gastric and intestinal peristalsis. In this case, just look at the abdomen. No peristalsis seen. But in some patients, when the peristalsis is hyperperistalsis, you actually can see the thing moving. Okay, you can see the skin moving as though like there's like a snake inside the thing where it moves, so you can see the thing moving because of peristalsis. It follows the intestine.
How come some people can have hyperperistalsis?
Depends on their metabolism, body. If the patients are asthenic patients,
And then
okay,
oh, you
and
can
he's having like gastritis, right? It's visible. You actually can see the thing moving. Like in some patients, if this a sympathetic and parasympathetic nervous system, just say it's malfunction, you can see. You can see all these cases happening. Okay? Next, we go to umbilicus. Umbilicus, no, it's normal. It's not elevated. It should be inside. It should be depressed. Okay, the umbilical should go inside. So in this case, it is normal. Next, abdominal circumference. Abdominal circumference, you must use a measuring tape. Put the measuring tape here and you measure. And then you tell what's the size. Okay, so make sure you have a measuring tape with you. Okay, so we are finished with adiposis.
Will they ask like during the test, like when you measure and then after that they ask what's the abdominal circumference for obese?
No, usually not.
Actually, at which point? Actually,
Just
not the hip already, just
not the hip, near your umbilicus.
Okay.
You put it and just bring it near your umbilicus. Okay. Next, we go to surface abdominal palpation. Okay, surface abdominal palpation. Okay, usually, first you need to ask the patient, are you feeling pain? Okay, ask your patient where he feels pain. If there is no pain, okay, so you ask the patient first, patient, are you feeling pain? No pain. When there's no pain, you usually start from the left. Okay, I mean the patient's left hand side. Okay, you start from the left and you go anti-clockwise. Okay, anti-clockwise. But if the patient says he feels pain here in the left iliac region, then we start from the opposite side. So opposite side would be here. So you move from here, from right to left.
The painful side.
Yeah,
from
no,
the
no.
opposite. on the
Opposite.
left.
If he's feeling pain here, right? So you start palpating from here. Okay. And one more important thing is, during palpation, look at your patient. Don't look here. Don't look here. You have to look at the patient. Why? Sometimes your patient
Show sign of pain.
lies.
Oh,
Your patient lies. You say pain, you say no pain. But when you look at the face, when we press, expression, facial expression can be seen. So always look at your patient. Okay. Even in exam, look at your patient because she would be noting all this. Okay. Don't forget. Okay. So now let's start surface abdominal palpation. First thing, hand straight, straight on the abdomen fully. No bring up like this. Wrong. Okay. Place your hand fully on the abdomen. Okay. So we start first surface abdominal palpation. So it's up to you. You can each time you do, you can ask the patient, are you feeling pain? Or you just inform the patient, if you feel pain, please inform me. That's much more easier. Okay. If you feel pain, inform me. Then you start. Okay, we have gone anti-clockwise. Then in the middle, don't forget. Okay, we are finished with this. That is surface abdomen palpation. Next, we get to Mendel sign. Okay, Mendel sign, the same thing. Okay, next, rebound tenderness, like this monkey hand. Okay, like this. Just check for if there's any tenderness in the muscle. Okay, we have finished with that. Okay, next we check for Shotkin-Blumberg symptom, where is usually checked in the McBurney point. Where is the McBurney point? So, okay, you take the patient's anterior superior iliac crest till the umbilicus, okay, here, and you divide the line into three portions. Okay, first half, second, and the third half. So, where are you supposed to place your hand? In the lower third. Okay, so if this is the line, okay, here, so okay, here, okay, you place your hand here, then same thing, ask the patient to inspire and expire. So inspire, skin fold upwards, expire, skin fold downwards. Okay, inspire, skin fold upwards, expire, skin fold downwards. So it goes up, comes down, it goes up, comes down, you push up, pull. Okay, you feel. For what we do here, what to check in this region, in which diseases, GIT pathology we check here. Appendicitis. Yes. What else other than appendicitis? If it's a female patient,
Something with a female.
yeah, what? Ovaries, yeah. In which pathology? Ectopic pregnancy. In ovarian cyst. Okay, in ovarian cyst, ectopic pregnancy. All. Okay, this is actually a differential diagnosis. Okay, it's not necessarily appendicitis alone. It can be ovarian cyst. It can be ectopic pregnancy. You know, it can be even this inflammatory bowel syndrome. Anything can cause, not only appendicitis. Okay, it can be what? Muscle. It's just because of the muscle. You know, the muscles are weak. It can also cause pain. Okay, so this is done. Next, you also have to check on the left hand side. So same thing, anterior superior iliac crest to the umbilicus, the lower third. Put your hand here. Okay, not like this on your hand. Your hand is always like this. Okay, put your hand here. Same thing. Inspire, skin fold upwards, expire, skin fold downwards. Okay. Okay. Monkey hand. Huh? Go up, come down. Go up, come down. Okay. Done. Next. Another sign. If you're going to do it here, right? The same thing which you did here. If you do it here, what sign is it? Roff-Singh sign. Roff-Singh sign. Roff-Singh sign is used for what? How to spell it? R-O-V-S-I-N-G. Roff-Singh sign. Roff-Singh sign is also used to detect what? Here, this side. In which pathology?
Inflammation or something.
Also appendicitis.
Oh, eh?
Yeah. Why?
Come.
When you insert pressure here, the patient feels pain over the right iliac fossa. That's called Roff-Singh sign. It's used in appendicitis. So, because remember I told you, if you do it here alone, it can be many causes. Ectopic pregnancy, muscle, it can be inflammatory person. But to reconfirm it's appendicitis, you do it here. The same thing. And if he feels pain here, then you can confirm it as appendicitis. You know, but of course after you still need to conduct an ultrasound, you need to do blood analysis to check for leukocytosis and all this stuff. But to make sure it's appendicitis, you do it here. Okay, that's called Roff-Singh sign. Huh?
So it's not Shotkin-Blumberg, right? Shotkin-Blumberg
No, it's
is
also Shotkin-Blumberg. It's the same thing. It's just in different location. Instead of right, we do it on the left. But it's also the same method, Shotkin-Blumberg method.
So if you do it on the right, so it's Rolfsing sign.
Yeah.
I
On
mean
the
the
left.
left.
Yeah.
It's not Shocking Bunga, right? It's called Rolfsing sign, but the method is
yeah. Okay.
Mm.
So, but in exam you have to do it both sides, huh?
Mhm.
Do it for them. Okay. So we are finished with that. Next would be palpation of hernia or tumor. How are you supposed to do? Usually hernia and tumors they occur here. Why? Why in the middle?
No muscle.
Hmm?
No muscle. Just
No muscle. There is muscle, but
just
muscles are weak. Your abdominal muscles are very weak. Weak abdominal muscles. That's why hernia is prone to occur here in these areas. Tumor, all very prone to occur here. That's why you have umbilical hernia, which occurs here. From the it just comes out. The hernia. Okay. So how do you check for this? Put your hand here. Okay. Yes. Place your hand. Just lift up the patient. Okay. 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 So once you lift up the patient and you put your hand here, you can feel the tumor or the hernia hitting your hand. Then you know that there's something underneath. Okay? That's for tumor and hernia. Next would be for ascites. How do we check for ascites? Ascites, there's two methods which you can use for ascites. One is percussion and one is fluctuation and percussion. So fluctuation, how do I do it? I'll put my hand over here. Ask the patient to put his hand like this, and you just tap. Just tap. Okay, tap 2 times. If there's fluid, once you tap, you can feel the waves moving here. You can feel the waves here. Okay, that's one method. Next method is percussion method. How do you percuss? Same thing. First you percuss from here till you hear dullness. So, start percussing. Dullness of sound. So it was here. Okay. Next, to reconfirm it, you ask patient to turn laterally. Okay. Patient turns laterally, and then you percuss again. It was in the same point. So if it's the same point,
Means
no
fluid
absence of fluid, no fluid, no ascites. But if there's difference,
Means
then
there's
there's some fluid in the body. Okay, understood?
Yeah.
Sure. Okay. Next, stomach. Okay, in stomach, first we need to determine the lower border of the stomach. So, stomach lower border is somewhere here. Okay? See, your stomach goes like this. The greater curvature.
Sorry, Shakil.
Yeah.
For the ascites, do we have to do the third one?
You mean the
Puddle
puddle
sign,
sign?
puddle sign.
Puddle sign.
No,
Puddle sign. Because puddle sign, you actually need to go under the patient and you have to focus. So it's you don't need to puddle sign. Okay, but if she asks, you just have to tell her lah. You can also use puddle sign. But how do we do puddle sign? I mean, what's the position of the patient? Yeah, the knee and your elbow kan on the okay. You lie like that. Okay. So stomach. Okay. So the greater curvature of the stomach. Okay, we need to determine the lower border. There's also 2 ways to know. Okay. I mean the percussion method. There's 2 percussion methods. One, you percuss from top coming down, or from down going up. So midline, 1 centimeter away from the midline, you place your hand. Okay. Then you move downwards. Here. His stomach is here. Okay. Stomach lower border is here. Next method, I can percuss from down going up.
Come in.
Here. Okay. So this is his lower border of the stomach. Okay, that's the first method. Next method, you also can use succussion splash. Succussion splash, you need to ask the patient to drink a cup of water. Okay, drink water, then he lies. Then your left hand, keep it like this. Okay, monkey hand. Okay, monkey hand. You start pressing. When you are pressing, don't remove your hand. It's like you press but move downwards. So you move downwards. Okay. Once you hear the splash sound, so that's where his lower border is. But it works because we have tried it in her class. You really can hear the sound. Okay, that's succussion splash. Next, ausculto friction. Ausculto friction. What you need to do is place your stethoscope here. Okay, just under his left iliac arch coast. Okay, put it there, then you friction, ausculto friction. Once you hear the changes of sound, that's where the lower border is. Okay, that's ausculto friction. Next is ausculto percussion. Ausculto percussion is the same. Put your stethoscope here. Okay, and you just percuss onwards. Okay, you can hear. So altogether there are how many methods now? There are 4 methods. Okay, to determine the lower border of the stomach: ausculto friction, ausculto percussion, succussion splash, and normal percussion. Okay, there are 4 methods used to determine the lower border of the stomach. Next, palpation of the stomach. Palpation of the stomach, first you need to percuss. So you start percussing. So here's the lower border of the stomach. Place your hand here. Okay. Place your hand here. And inspire. Skin fold upwards. Expire. Skin fold downwards. Okay. This is 1. Next, you move laterally a bit. Okay, you move laterally a bit, and the same thing. Inspire, skin fold upwards, expire, skin fold downwards. Okay, go up, come down, go up, come down. Why you do it here and here? Here is to just to check the curvature of the stomach. You can feel the curvature of the stomach here. Okay, so first, second, just here and just move a bit laterally a bit. Okay, that is to determine the palpation of the stomach. Okay, next would be the pyloric. Okay, how do you determine the pyloric? This sphincter region there. Okay, midline, umbilical line. Okay, it forms 90 degrees. Yes, 90 degrees. Make a 45-degree line. See, midline, umbilical line. It forms 90 degrees. Next, cut through this, so it forms a 45-degree line. Right. So this region is where your pyloric is. Okay. Place your hand here. Okay.
Oh, right at the angle.
Yeah, at the angle. You place your hand there, and same thing. Inspire, expire. Inspire, expire. So you feel the pyloric here. Okay. Just remember, midline, umbilical line, 45 degrees. Place your hand there. Okay. That's the pyloric. Okay. So we have finished with stomach. Any questions about stomach? No.
When you make skin fold, right? How deep do you go? Like,
No, this is not deep palpation. So it's just normal. Skin fold upwards and go up. That's it. Okay. Next, intestine. Okay. Intestine. Let's remember you start from sigmoid, cecum, descending, and sigmoid, cecum, descending, ascending, transverse, then ilium.
What happened?
Ilium is the last one, right?
She said sigmoid, cecum, ilium.
She said
Sigmoid, cecum, ilium.
ilium first, as she said.
She said.
She changed the method again.
Okay, then we just follow that lah. Okay, sigmoid. So sigmoid is the same like how we did just now. Okay, exactly the same method how you did for the Hodgkin Bloomberg. Okay, same thing. Place your hand there. Skin fold upwards. Skin fold downwards. Okay, first sigmoid. Next cecum. Same thing. Skin fold upwards. Skin fold downwards. Okay. Next ilium. Ilium is always below the umbilicus. So she told us last time it's just like 1 to 1.5 centimeters below the umbilicus. So you just place your both hands here. Okay. Place your hands here and skin inspire, skin fold upwards, expire, skin fold downwards. Okay. You feel for the ilium. Okay. Next. Ascending column. Sorry. Descending column. Okay.
Ascending.
Oh, she
She said
told ascending first.
Yeah, ascending first. Ascending.
Okay. Ascending. Ascending. So ascending. Hand under the lumbar region. Okay. Mid clavicular line. Umbilical line. Where it meets. Okay.